Welcome to Wellness Wednesday with the Department of Parks and Recreation, Prince George's County. This is your home each week to stay healthy and motivated on your path to wellness. Let's live more, play more indoors.
Hello, my name is Dr. Christopher Nelson. I'm a physical therapist for MedStar Health. For Wellness Wednesday, I'm here to talk about the lumbar spine. The lumbar spine is the most common body part that we see in outpatient orthopedic physical therapy. There are 3 different categories of back pain that we typically see. The first category is acute. This pertains to back pain that lasts for less than 3 months. The second category is recurrent back pain. This refers to acute back pain symptoms that subside for a period of time, but then come back. The third category is chronic pain, which is described as pain that lasts for 3 months or longer. In broad terms, we can break low back pain down into nerve pain, bone pain, and muscle pain. Nerve pain occurs when pain from the back radiates down into your leg and/or your foot. Some people refer to this as sciatica. This pain tends to be burning, shooting, or can make your leg feel numb, as if it's fallen asleep. Bone pain can be caused by arthritis. This occurs when the space between the vertebrae in your back gets smaller. This is common as we age, and some people who have arthritis in the back don't even realize it. Muscle pain is caused by a pull in one of the larger muscles in the back. This can be caused by lifting something too heavy, being involved in a fender bender, or simply overusing the muscles over an extended period of time. Physical therapy interventions include strengthening of the small, stabilizing muscles in your low back and your abdomen to help decrease your pain and improve your function. One commonly prescribed exercise is a posterior pelvic tilt. This engages the small muscles in your abdomen and your low back to help stabilize your spine. For this exercise, you will lie on your back with your knees bent and your feet flat on the floor. You will tighten your abdomen by drawing your belly button up and in, as if you're trying to bring it toward your chest. You will then flatten your back into the floor or the bed and hold it for 3 to 5 seconds. You want to ensure that your bottom stays flat on the ground and that you're not holding your breath. If you seek physical therapy to address your low back pain, your intervention should be tailor-made by your PT to fit your specific needs. Strengthening your lower body can also assist with back pain. The muscles in your legs, such as the glutes, quadriceps, hamstrings, and calves, all get their innervation from the nerves in your low back. An injury to the back can negatively affect the strength in your legs. Adding exercises to strengthen your legs are a key part of strengthening your back and keeping it healthy. One functional exercise that you can do is a sit to stand. This will target the large muscle groups in your legs. You'll start with your feet firmly on the ground. Ideally, you'll be seated in a firm chair. Without using your hands, you'll stand straight up and then slowly descend back to the seat. One thing you want to be aware of is keeping your knees from collapsing inward as you descend back to your seat. This can cause increased pain on the front or the inside aspect of your knees. You may have often heard the term lift with your knees when confronted with lifting something heavy. This is a slight misnomer because you want to lift with the muscles in your legs. Now, ideally, you will bend your knees to execute the lift, but there are a few more steps that we'll go over. The best way to lift a heavy object is to start with your feet about shoulder width apart. Bend your knees and straighten your knees to come into a standing position. Avoid trying to lift the object straight up into the air with your arms. This can lead to an increased strain on your back. The top recommendation to keep your back healthy and how to treat it if you suffer an injury is to maintain an active lifestyle. If you sustain a back injury, you want to avoid prolonged periods of inactivity. The back wants to move, and avoiding movement will only cause the problem to worsen. Some good low-impact activities to include are walking, biking, water aerobics, and yoga. Low back pain can sometimes be a worrisome diagnosis, but with proper exercise, good daily habits, and good body mechanics, you can help decrease your pain and lower your risk of developing chronic low back pain. That concludes this week's Wellness Wednesday. We will see you next time.
Thanks for joining us. Be sure to tune in again for the next Wellness Wednesday.